Independence Day celebrations we're used to, complete with show-stopping fireworks displays, are on hold this year in many places because of the pandemic.
That means many people might be tempted to create smaller fireworks shows of their own. Joining us now with important fireworks safety information is Dr. Staffy Poulakidis. He's the director of the Cook County Health Burn Unit. Thank you so much, doctor, for joining us. First of all, we know that fireworks, especially in the Chicago area, have been ramped up. I think I've started hearing them back Memorial Day. Without telling folks what you should and shouldn't do, give us an idea of what can happen if you do use them improperly, what you've seen at the hospital.
Absolutely. Thank you for having me. We're very pleased to be able to share some knowledge. What we're seeing is injuries much earlier than we would ever expect, with injuries starting as early as the beginning of May because of the pandemic, etc. And what we're concerned about is people losing fingers, digits, having injuries from perspective of large mortars that could potentially hurt not only the person who's actually setting off the firework, but those around them, especially elderly and young kids who can't respond as quickly as they should.
Doctor, I've done stories over the years, probably Mike as well. People have actually died from this kind of stuff. When I was younger, like the Roman candles and M80s were standard fare, but that kind of pales by today's comparison, don't they?
Absolutely. We're seeing half sticks dynamite, quarter sticks of dynamite, much larger explosives than we've ever seen in the past, which can be extremely limb threatening, but more importantly, life threatening. And we really want people to be safe. We realize everybody's been locked up with pandemic, and we realize they're not going to be able to have festivities this year. We're really asking people to really prevent the use of the illegal fireworks, which they are in the state of Illinois.
Yeah, people are going in droves across the border trying to get them, not realizing, I mean, they may seem fun at the time, but my goodness, I mean, the injuries, like Patrick said, it could lead to death. And dogs, I should say, too, are really having a hard time listening to this, you know, being anxious, and the anxiety is terrible because of the loud noises. Anything that I know you're not a veterinarian, but what can we do for our dogs?
Try to quarantine them, so to speak, not to make any pun here, but quarantine them from the fireworks right around the area, maybe keep them inside the homes just to keep them safe, because they do get terrified from those injuries as well. Again, I'm not a veterinarian, but I think that's probably the best advice, and just to keep them safe.
The wild card to all of this is that when you throw in alcohol, all bets are off.
Correct. Alcohol and drugs really exponentiate the magnitude of the injury because your reaction time is just very poor. So we ask people obviously not to utilize the fireworks because of the illegal nature, but if they do, to definitely avoid drugs and alcohol, because something as easy as a sparkler can cause significant harm because they can burn from 1,200 to 1,800 degrees Fahrenheit.
I think it's amazing that you're seeing these injuries so early, and folks don't understand, especially with the pandemic, we don't want to crowd our ER rooms, do we?
Absolutely not. We want everybody to be safe. We want everybody to have a nice time and enjoy the holiday. And we want everybody to just be careful and, God willing, utilize those fireworks next year.
Yeah, thank you, sir. Also, sparklers, which I used to use as a kid thinking it was no big deal. Those aren't good either.
No, very dangerous.
All right. Dr. Staffy Poulakidis, thank you so much, director of the Cook County Health Burn Unit. I hope you don't have to treat too many kids for this. Thank you so much, sir.
Thank you, Doc.
Have a good day.
You too. Be safe, be well.